Hi there, I'm Dr. Martin Benfield. I'm a GP trainer, and this video we're going to look at how to consult in the SCA examination. It's the second of two, so if you haven't watched it already, there's another video on this channel entitled the SCA exam and how to prepare for it. There are several key factors that I feel are important for being successful with this examination. Really understanding the presenting complaint properly, and then asking questions to probe your differential diagnosis list we discussed in the last video. There are videos on this channel describing all the tools you'll need, such as how to explain conditions and how to discuss management plans. There are also some videos that will look into some of these skills that we're going to discuss in this video in more detail. So the SCA exam is designed to test your ability to cope in a range of different scenarios. Some of the consultations will be standard medical types, such as a person presenting with new onset abdominal pains or other medical symptoms. Some are going to be slightly different, such as a parent consulting about their child, or a person consulting about elderly relatives, a social worker needing to discuss one of their clients, a patient angry about their hospital care. Some may start awkwardly, I need you to do a referral for me, or early in the consultation saying, what do you think I should do? The most important thing is to remember, no matter what the scenario, maintain your consultation structure. You always start with data gathering, and then you move on to your differential diagnosis list, then you discuss management plan, and then you finish with a follow-up and safety net. Never be tricked into explaining what you think is going on before you know all the facts. Never be tricked into giving advice before you know all the facts. The awkward consultations are often the ones where you'll need the skills discussed in the other videos that enables both you to maintain control over the consultation and the patient to understand what is happening. Sorts of skills you'll need to practice includes early signposting to explain to the patient what is going to happen in the consultation. Understanding what the person you are consulting with knows already. Adapt your ICE questions to the situation. Use of acknowledgement with signposting. Describing the issues to discuss. And offering the management plan as options for the patient to choose. So in this video, we're going to look at those 6 skills in slightly more detail. First skill is taking control of the consultation early. This is required when the patient tries to ask for early explanation or treatment discussion before you're ready. So a line such as, before we discuss what we can do about this, I need to find out a bit more about what has been happening. You may need to give further signposting, further explanation about why you need to find out some more before you start discussing. It can be tricky when you have a result or something like a hospital letter that the patient wants to discuss. And this merges into our second of our skills, understanding what the patient knows already. You need to balance obtaining more history against leaving the patient too long before giving them the answer. In the SCA, if you are given a recent result in the pre-consultation brief, plan your tactic about how you're going to phrase bringing this into the consultation. In this scenario, the best line will often be, what do you know about why the test was requested? The next thing you say will probably be the result. If the patient gives a very short answer, then they probably are very keen to know the result, and you might want to ask more questions to clarify some things, but be very careful about making the patient frustrated that you aren't giving them the answer. If the patient gives a long description, then they're probably happy to chat and have a proper data gathering before you describe the result. If the result is given quite early, it's important to don't be tricked into then getting into the diagnosis and management stage. You need to reverse back, signpost, right, before we decide what to do about this, I need to find out a bit more information. Finding out what the patient knows already is part of really understanding the presenting complaint. And this is particularly important if the person has had previous consultations about the problem, such as with another GP or hospital doctor or another health professional. They must have been told things. You need to know what they were told, because if you start giving a different explanation or plan, you're going to run into trouble. What did the patient think of that explanation or plan before? If, for example, the patient is attending as a follow-up to a hospital clinic appointment, you could ask, so when you saw the hospital consultant last month, what did they say to you about what was going on? What did they say to you they were looking for on this scan they organised? What was their plan if the medication didn't help? After finding out what the patient knows, you will probably want to ask open questions to understand the presenting problem better. Maybe the occasional closed question to clarify anything important, and then the next skill is adapting your ICE questions. This is something you should be doing all the time. Where a person has had discussions before about the issue, the causes and plans have likely to have been discussed, and therefore you need to adapt your ICE questions for this. You may be aiming to add other than or anything else into your ICE questions. So, other than an infection, was there any other thoughts you had about what might be causing this? Was there anything else you were thinking of or concerned about that wasn't covered at the hospital appointment? Were there any other tests or treatments you were wondering about that haven't been discussed so far? Was there anything else at the last consultation that you felt wasn't really covered or discussed? The next skill is acknowledgement with signposting. Now, this is used when you feel you have heard enough from one area of the consultation, the presenting complaint, and you need to move the consultation on to the next stage. It's an empathic statement that shows you have listened to the patient and then immediately takes control by explaining what you're going to do in the next stage of the consultation or asking the next question to move it on. That first statement we talked about before, about taking control of the consultation, could be an example of this. So you might say phrases like, sounds like you've had a frustrating time with those hospital appointment systems. Did you have any thoughts about how I could help with this? Sounds like you and your family are having a really tough time at the moment. Have you done anything already to try and help with the situation, or had any thoughts about what to try next? These symptoms are clearly having a significant impact on your life. I would like to ask a few more questions to check we haven't missed any serious conditions as a cause for them. Where possible, demonstrate you're on their side, for example with statements starting with "we need to." Okay, so we need to work out what to do next. We need to have a think about any other tests that need to be done. After data gathering comes the differential diagnosis list discussion. It's extremely unusual not to have more than one cause for any symptoms. So you're always going to discuss what you think is most likely, maybe anything else you think is possible. You need to discuss anything the patient thought of that might be a cause, anything the patient might be concerned about, and anything you think you're going to talk about in the safety net. There may be consultations that are about issues rather than a diagnosis to be looked for. And that brings us to our next skill, describing the issues to discuss. This is a summary of the management plan and is a good skill to practice whenever there is more than just the standard tests and treatment management plan to cover in a consultation. It's another form of signposting that helps you plan your management discussion and helps the patient understand what's about to happen. The opening line could be, so there are a few things we need to discuss. Or, okay, so we need to make a plan for a few things. And then you can list out the summary of those things. We need to look at how best to try and sort out that hospital appointment problem. We need to think about your work situation. There are a couple of additional tests I think we need to do. And sounds like we need to have a look at maybe a different medication. Does that cover everything? The final skill being discussed in this video is offering management plans as options for the patient to choose. It needs to be an informed choice, so enough information needs to be given so the patient understands the choices they're making. You can give direction, you can give an opinion, as long as the final decision is the patient's. If the medication was for something simple, like a simple symptom relief, then an early question can be asked. Is that something you'd like to try medication for? We could either, as an example, we could either just keep trying with your feet up more than you're doing at the moment, or we could add in a medication to see if we could remove the fluid. What do you think? You can then go on to explain about the medication and finish with, is that okay? For preventative medication, it's a bit more complicated. Things like blood pressure, whether to start blood pressure treatment. The patient needs more explanation before they can make an informed choice. So remember to explain what will happen without treatment as well as with treatment. If we don't reduce your blood pressure, you're more at risk of. What I would suggest is that okay? After the management plan, you will finish with a sensible follow-up plan and safety net. And then remember, practice by doing as many different consultations as you can and record them so you can watch them to see how you're doing. Good luck.